Thank you, Mr. Chair. Honorable colleagues, I want to use my time to speak about the Ebola outbreak in West Africa, the largest ever recorded to date, and to highlight international efforts as well as my own country's response to address it. I was very heartened to hear that our colleagues from the delegations of Chile and Malaysia had put forward a resolution on this topic. Canadian parliamentarians have also been deeply concerned by the Ebola outbreak and its devastating effect and impact on the peoples of the region, in particular Guinea, Liberia, and Sierra Leone. I think it's worth noting that the situation became so dire that in September 2014, the UN Security Council determined that the unprecedented extent of the Ebola outbreak in Africa constitutes a threat to international peace and security. The Government of Canada has contributed to global efforts to combat this outbreak, including through funding equipment, research, and expertise, as well as the deployment of personnel. Overall, Canada has committed over $113 million in health, humanitarian, and security support and domestic preparedness measures to address the spread of Ebola. Canadian support has been provided to a number of organizations, including the UN Mission for Ebola Emergency Response, the World Health Organization, Red Cross societies, and non-governmental organizations such as the Doctors Without Borders. Moreover, an experimental Ebola vaccine has been developed by researchers at the Public Health Agency of Canada's National Microbiology Laboratory in Winnipeg, Manitoba. The Government of Canada provided a donation of this experimental vaccine to the World Health Organization so that the vaccine could be made available as an international resource. Furthermore, in November 2014, Canada committed additional support for research and development of the Ebola vaccine and antibody treatments for Ebola. Clinical trials of the vaccine are underway domestically and internationally. The results of these trials will provide critical information regarding the safety and appropriate dosage of the vaccine. With respect to on-ground support, Canada has provided experts from the Public Health Agency of Canada and sent 2 mobile laboratories to Sierra Leone, designed to provide diagnostic support and to monitor the effectiveness of infection prevention procedures. Recently, a team of Canadian Armed Forces doctors, nurses, and support staff commenced operations in Sierra Leone as part of a mission to provide essential medical care to local and international healthcare workers. They are working alongside counterparts from Britain. Colleagues, I think it is important that as parliamentarians, we all take stock of policy issues that have been raised by the Ebola crisis. These include the need to and for more effective early warning and response systems, improved coordination of international and national responses to health crisis, and a call to strengthen national health systems. We should also examine how we can collectively manage air travel and airport security when confronted with the need to contain a global health emergency. I want to conclude by acknowledging the incredible dedication, resilience, and sacrifice of healthcare and humanitarian workers who have responded to the Ebola outbreak in West Africa, many who have lost their lives. This point is underlined in one of the draft resolutions we have before us. These brave individuals working on the front lines deserve our continued support and our commitment that we will do all we can at the political level to ensure a coordinated, robust, and sustained international response to this crisis. Thank you very much.
Muchas gracias.